You have experienced the benefits of my technique called the O'Connor technique. And how long have you been using that technique now?
I've been using it for at least 10 years.
10 years.
Right.
And could you tell just briefly your story of what happened and what brought you here? Something about, I think your son at first realized that I could do this. Yeah, that I had that technique, and he bought my book. Go ahead and tell the story.
Right. Well, my son read about Dr. O'Connor's book, and he purchased it. And when I hurt my back...
This was 10 years ago.
10 years ago. He had a severe back problem, but because he had surgery, you know, his diagnosis was different than mine. I didn't wait until I had surgery. So I came early. And with doctor's technique and his advice and his just his
instruction, individualized instruction,
yes,
whatnot.
That I knew what I needed to do. But often then, I fell back. So this is my fourth time back here to see the doctor to get readjusted and...
Re-educated.
Re-educated, that's the word.
Now, your son was a runner, wasn't he?
Yes.
And he couldn't run anymore.
No, he couldn't.
He was in too much pain.
Right.
And he came to visit me, and I taught him my technique. Right. And I haven't seen him as a patient for 10 years or
right.
plus.
And he's running.
Yeah, and he's still running.
He just ran in the Houston Marathon this February.
And when he first approached me, he could not run because he was in such pain.
Right.
Right. And so he got my book, and I can't remember whether, I think he came to me as a patient as well.
Yes, he did.
And I showed him how to put his back in through my technique. He had the book, and ever since he's been out of pain, right?
He's been out of pain, yes.
Right.
And if he does have any pain, he knows the moves, the techniques that he has to use to get back where he was originally. And he's been, I don't know how many marathons already. He must have had at least 12 or 13 marathons.
Right. And you know those techniques too. So they've also, how old are you now?
80.
80. So this can work on 80-year-olds.
Yes, by all means.
Right.
I mean,
and so basically you're able to use the techniques that I taught you to take yourself out of pain when you get into it, for the most part.
Right.
Now, just the other day you called me and you explained what had happened and why you were wanting to learn more about what to do in this state that you're in.
Right.
And my recollection of that is on the phone, I instructed you in how to properly maneuver.
Right.
And what did you have? You had pain shooting all the way down to your foot, right?
Right.
Now, what did other doctors say about that? Did you go to someone else in Illinois?
Right. The first doctor I went to was the orthopedic because I have a knee replacement in that same leg.
Yeah.
And he checked me out and said there was nothing wrong. Then I went to my family doctor, and he said the same thing. He said, well, but my first orthopedic doctor said, maybe you ought to see a neurologist. And I thought, well, I'll go to my family doctor first, which I did. And my family doctor said, yes, always go to a specialist. So I went to the neurologist, and he suggested surgery. And I thought,
on your back.
On my back.
He said that your nerve was being compromised. It was pinching, that a piece of the disc was squeezing the nerve.
Right.
He did an MRI and showed it and said to you that the only solution, really, from his perspective, was to fuse the disc.
Right.
Now,
and he advised me to go to the University of Illinois, Chicago.
Now,
and
a phone call that lasted from me probably no more than 30 minutes had what effect?
Well, I went through some of the maneuvers that we discussed on the phone.
Yeah.
and it relieved the pain. And I thought, well, if these maneuvers, without the doctor seeing me, could remove this pain, then I wanted to see him because there had to be more. And that's why I was here.
So now you feel you're confident to go back to Illinois from California, and you feel that you know enough, and with your daughter,
Oh, definitely.
you were taught enough that you feel confident that you're not afraid now that you're going to lose the use of your leg, and the pain in your leg is gone, and you're
Mobile again.
mobile again. Yeah, we just walked about
Right,
maybe
to the
4 blocks or 5 blocks, and you have no pain, and
No.
you got full range of motion. And
Right.
that was not but 2 weeks ago, or how long ago was the surgeon telling you your only option was to have surgery?
I'd say, well, it was about 3.5 weeks. that
3.5
I saw
weeks ago.
the
But
orthopedic.
it was a week ago when you got the information,
Yeah.
because
Yeah.
that's when we
That was
decided
when I went for the
we were
MRI.
coming. We booked the tickets right away.
Yeah. So, would you recommend the O'Connor technique for other people similarly situated?
Yes, we
we
would.
And you wouldn't mind me putting this on the internet for people to
That's okay with
trust?
me.
Okay, thanks a lot.